for PESI and IMMH, which is the Integrative Medicine for Mental Health Conference. And we're here with Dr. Arwen Podesta and Dr. Joe Mather, who are two of our speakers for the IMMH. And we're so excited to have them here. And we'll be talking for about 15 to 20 max minutes on essentially an integrative approach to mental health. So Dr. Podesta is board certified in psychiatry and addiction medicine and in forensic psychiatry. And Dr. Joe Mather is board certified in family medicine. And they often collaborate and work together in terms of delivering an integrative approach to the mental health of their patients. And so what I'd love to hear from both of them and what they're going to be discussing at this IMMH conference, which is happening on the 2nd, 3rd, 4th of November of this year online, and the link is below, is, you know, what does it mean to have an integrative approach to mental health, and why is that important? So Arwen, Joe?
I'll jump in. Thank you for the introduction. And I just want to say I love this conference. I've been around this conference for quite a while, and it's always a great place to attend. This year, it being virtual makes it more accessible, but it doesn't have that community. So we'll look forward to next year in Boston for the community as well. But definitely make it to this virtual conference to get a taste of it and get the information. So integration, we always talk about integration in business and in science and everything, and you know, and it's collaboration, but it should be collaboration times 10 really. And integrating, I can be integrative personally with care for my patients. I integrate multiple different modalities, but then there's another level when you include other modalities with other practitioners that actually lends to a much higher level of detail and precision and of patient care. So Dr. Mather and we've been collaborating on many patients for quite some time. And we live in the same town, New Orleans, Louisiana, and we come from just almost opposite standpoints of training and of looking at the brain and body, but ultimately with the same goal and result. And so we fill in each other's gaps. We help each other out in so many ways, and really, more importantly, help the patient out. So, Joe, do you want to talk about how we've collaborated and kind of what an integrated approach means to you?
Yeah, well, this will be my first year at the conference, and so I can't wait, and I'm so excited to join you, Arwen. Doing a buddy talk, I think will be much more fun than just doing it alone, and
yeah,
that's kind of what we see in practice, right? We think that maybe if we take two doctors and put them together, we might get one and one is two. But I think what we've found over the years is that when we are really collaborating in a really respectful, fun, open way, you know, 1 + 1 might be 4. Right?
Infinity. Because 1 + 1 is infinity.
Infinity. Because I mean, the honest truth is, I'm board certified in family practice, and I've got about a decade of experience in functional medicine. But the knowledge that is emerging in all sorts of medicine is just exponentially increasing. And there's no way that I can be on top of all of psychiatry, right, when I'm doing a lot of patients work with the gut. Right. So having Arwen there to bounce ideas off of, to fill in the places where I don't know as much, right? To say, okay, I have this patient, they're depressed. The normal things aren't working, Arwen. Where would you go with this? And what would you do? And having her be able to pinpoint a medication or pinpoint an integrative treatment, be it amino acids, right? Be it all sorts of other supplements that we can use that are not just pharmacological. Oh my goodness, it helps so much. So one of the takeaways is, you know, we believe every practitioner needs to just buddy up, find people in your community that you can work well with. And sometimes it's even better if you think completely different, because I think one of the most fun things about our interaction is that we think differently. And that'll be one of the things that we talk about at the conference itself.
And even, oh, I'm sorry, Kirkland, I just want to say, even Joe, it's so fun because we think differently, and even creating our PowerPoints and even making our schedule to create the PowerPoints, we were coming at it from different standpoints. And think of what that does when it's a patient's wellness that's at hand. It's not this mono push. It's like really synergistic and coming at it from different angles.
And I think that's really the key point about integrative approaches to mental health and, to any health, but it's really about seeing the mind and the body as indivisible. And one of the mistakes I think that mainstream psychiatry does tend to make is seeing the brain or the sort of mental health as a sort of separate thing apart from the body. And I think what I love about integrative mental health and functional medicine psychiatry is really that sort of joined up approach between the brain and the body, and looking at the gut and the hormones and the infections and the inflammation and the amino acids and the supplements and all those things which are, so impactful to your mental health. And I think the beauty of the way you guys work together is that, you have two people on that. So you've got the psychiatrist who's also trained in functional medicine, and then you have the sort of family practice doctor who's trained in functional medicine. And I think, the patients are lucky to have you because of your joined up, sort of soup to nuts approach. And then in terms of PESI's audience, which tends to be very much psychotherapeutic, so a lot of psychotherapists, nurse practitioners, psychologists, I think one of the things that we wanted to really bring to this audience was the sort of the biochemistry of mental health, and the fact that, yes, trauma and adverse childhood experiences and all these mental health therapies that are used for those are really important. But what is the biochemistry behind that, and how is that impacting their patients' mental health, and what can they do about it? So do you guys ever work with psychotherapists, and how do you see that relationship working in terms of the biochemical and the psychological?
I'll start with that because I work closely. I have several psychotherapists in my office, and then I have probably over 150 that are on my referral spreadsheet that I either hand refer, or we get releases of information so that we can, share information and help for the patients. And oftentimes patients will seek psychotherapy first as their first treatment, or in my additional field of addiction, they'll seek, 12-step or relationships first, which are very important. And that therapeutic alliance is incredibly important. That peer alliance is incredibly important. But if you have certain structural anomalies, if you have certain hormonal or certain gut health or certain metabolic anomalies that are contributing to the pathology, to the inability to be successful in your psychiatric mental wellness, then we have to treat it as a medical, not necessarily with a medicine, but we have to address that biochemistry. And you're right, Kirkland, we know very well that your neurochemistry, your biochemistry is both affected by your psychological state and also affects your psychological state.
Yeah, completely. And Joe?
And yeah, I love everything and agree everything you just said, Arwen. From my perspective, both as a patient of Arwen's, who she is my psychiatrist, and someone who sends a lot of patients to her and sends a lot of patients to therapists, our patients deserve not just one modality. Our patients tend to be a degree sicker. They've usually failed multiple doctors before they find our way to a functional medicine or a functional psychiatrist. And usually one thing is not going to be enough. And that's just the unfortunate reality. We want a magic bullet. We want a one solve, for all of the symptoms, but it's almost never that simple, right? So where I think Arwen is able to give us biochemical support to get the neurotransmitters where they need to be, so maybe we might be able to do the work in therapy. I'm looking at it from maybe a third perspective. Why are the neurotransmitters off? Why do we have chronic inflammation? And maybe a quick patient story. One of the patients that Arwen and I worked together early on in our relationship was a young man who had really advanced depression. And Arwen had kind of max treated him and said, he's somewhat better, he's stable, but he's just not doing where I think he should be. And long story short, this young man was growing vegetables in New Orleans soil that was full of lead. So when I took a look at him, we found lead toxicity. And when we detoxed the lead, within 2 weeks, he really made a really quick turnaround, right? Then everything else worked better. He could deal with the underlying issues that he was working on in therapy. The antidepressants worked better. And then slowly we were able to get him off all that stuff. So I think our sickest patients who are struggling the most deserve all of it.
Yeah, I think that's absolutely right. And I mean, not just the sickest patients, I would say pretty much every patient, because to me, a joined up approach that looks at the biochemical, looks at the lifestyle behavioral, and looks at the psychospiritual aspects is the only way to sustainably treat people. And I think you make a really good point that the therapy works so much better if the person is in a sort of biochemically balanced place where they can work on their sort of childhood issues, their trauma, etc. So I think that's absolutely key. And in terms of the way you guys practice, I mean, do you do lab tests? Do you do to try and ascertain people's levels? Like, what are the key sort of labs that you run, and what are the key things that you find in terms of biochemical imbalances?
I do, on my initial exam, whether I'm working with Dr. Mather or not, I do a battery of blood work, and patients come to me with other blood work. So I sometimes just augment that with the things that I'm looking for. And that's my basic. I think I've done genetic work long enough that I can usually assess the phenotype without getting the genotype. I've done a functional medicine or functional psychiatry long enough that I can often assess what the problem might be. But then we're going to talk about that a little bit more, because I think different practitioners some want more testing, some want less testing, some patients want more testing, some want less testing. But Dr. Mather has a bunch of great information on that for our presentation.
Which is great. And the presentation, which you can register for, it's there's a QR code on the screen, and there's also the banner at the bottom. And I think that will be really interesting to get into the more nitty gritty of exactly what tests you guys use and what sort of biochemical imbalances tend to come up over and over again. And Joe, do you have anything to add to that?
Yeah, well, first, Arwen is to my right on these screens. I'm not sure where the listeners are, but the true sign of mastery, in my perspective, is someone who's done enough testing and seen enough patients that they will have an intuition on what's wrong. So when Arwen says she's done enough genetics and can tell the phenotype, that is true expertise and mastery, right? When you can get to that level. So I couldn't let that escape without just saying that, because it's very rare in medicine for people to get to that point. From my perspective, I do a lot of listening first, because most of my patients have come in and they've spent $8,000 on labs with a lot of other doctors, and they're not well. So me repeating labs may not always be the right move. And we'll talk about this at the conference. But for me, some of the things that might have often been missed are heavy metals, like that patient we talked about. For me, it might be mold exposure here in the Gulf South in particular. There's a lot of mold. And I know, Kiki, you've talked about that on your podcast, and this is a hot topic. I'm also looking for things like sleep apnea. So perhaps we're doing a sleep study on patients. We're looking for certain nutrients that may be deficient. It'll be different for each person, right? Because each person will have a different reason why they're struggling.
And that really is, it's always confusing. I mean, do you call it personalized medicine? Because it's personalized, precision medicine, functional medicine, systems medicine, integrative medicine. It all really points to the same thing, which is it's an all systems approach, which is also personalized to the individual, and that makes a huge difference. And so before we wrap up, and I cannot wait, by the way, to hear your talk at IMMH, I think it's going to be amazing. Just in terms of, if you are a therapist and, do you think that, I mean, in my view, but this is just personal, I feel that every therapist in the world should team up with functional medicine doctors or integrative doctors and have a sort of team, a mental health team of which they're part. Do you think that's realistic? Is that something that you guys would like to see more in your practice, or that you think is a possibility?
It's absolutely realistic.
It's realistic. It's necessary. We have too few therapists. We have too few psychiatrists. We have too few functional medicine, integrative physicians in general. We have too few prescribers that really listen and do a full head-to-toe clinical evaluation from a functional standpoint with the patient. And for those that are interested, I think it's imperative to find, even if it's just not necessarily like someone that you're doing releases of information with every patient or collaborating with every patient, but you can have a listserv, have some professional overlap, have journal club, have some ways, someone that you can present a patient to and say, who do I refer this patient to? I think it's imperative. And I think if we're not doing that, then we're missing some very key points to take care of the patient best.
Because we all have biases, right? We all have biases, we all have blind spots, and we can't be experts in everything. And so having someone who thinks differently and has a very different realm of experience than you is truly invaluable.
And I guess that points really to the benefits of an MDT, which is a multidisciplinary team, which is such a powerful concept in medicine. It's like each patient should have this multidisciplinary team, which basically looks at all aspects of their mental and physical health. And the other thing is that, there are some psychotherapists who also practice functional medicine, who are trained in functional medicine and who are sort of a one-stop shop. And are able to do the therapy, but also are able to prescribe labs and supplements, etc. And I always think that's quite powerful. And so there are different ways of delivering this type of medicine. And I think certain cases are more complex than others, but, some people might have much lighter cases and maybe they just have a zinc copper imbalance, which is a sort of low hanging fruit. Others are much more complex and may have multiple infections and toxins and things that need dealing with a more sort of sophisticated team. But I think it is possible to train in functional medicine as a psychotherapist and then also be able to treat possibly the sort of lower hanging fruit, people who are sort of mildly depressed or mildly anxious and don't have super complex cases. Would you say that's something to aspire to, or do you think that it's always better to have this sort of multidisciplinary team? I guess it depends on the complexity of the patient, maybe.
Yeah. There are a lot of layers.
I think we're going to, just from my perspective, the amount of the increase in mental health problems, symptoms I'm seeing after COVID, I think means that everybody needs to get themselves as advanced as possible to help people, because I think there's just a flood of people really suffering from depression and anxiety. And the more that we can have therapists learn about, the power of the gut, how much overlap there is between IBS, anxiety, depression, brain fog. I mean, if you're looking for low-hanging fruit, the more we can just have people talk about what are the basic diets and say probiotics that can really shift someone's gut health and get them better. And it may not take a whole bunch of extensive labs, right, to get there. It's just hitting the things that make a difference. And we'll talk about what we think those things are at the conference. But I think we're kind of everybody, we're in such a hole, right, that we just need people to beef up and get better. And I think we're probably preaching to the choir, because if you're coming to the conference, you're already thinking advanced.
Exactly. And if you're not coming to the conference, you should come to the conference, because it's going to be amazing. And there'll be so many wonderful talks. We have 18 of the most renowned doctors and scientists and health practitioners in the world, in fact, coming to present at this conference. And it's the largest integrative mental health conference in the world. And so we're really excited to be doing it and doing it with PESI. And we're really lucky to have speakers such as you guys who are just so on top of your game. So thank you all so much. And Arwen, is there anything that you want to say, because on that last point, or are you?
Yeah, I do want to mention something, because, you've done tons on your podcast. You've interviewed lots of people that give really palatable and easy pearls and information. And honestly, that could be, if a psychotherapist or counselor wanted to use your podcast, for example, as a place where a patient can do their own research, because of course we don't want a psychotherapist that is not certified to provide these recommendations to do that, because that's outside of the scope of practice. But there are resources out there now, and you're one of the big heavy resources out here at Kirkland. And so I think that your podcast and your interviews can be really helpful and just informative for a psychotherapist to say, hey, this isn't my forte, but look, we have these tools that you can just look at this website and do this for yourself. Like, I suspect this might be related after coming to our conference, after seeing our talk and the other 16 or 17 practitioners talk, But I think that Mind Body 360 is a really fantastic resource as well.
That's so sweet. Well, thank you so much. I mean, I think it's important. It's all a continuum. It's patient education, and then the practitioners, we're all learning all the time, right? And it's impossible to be on top of everything. So I think it's super important to have these tools, whether they're podcasts or conferences, to really, as Joe was saying, beef up our knowledge, and whether we're patients or practitioners, and to make, to address this huge epidemic in mental health issues, which is terrible. So, well, look, thank you so much, both of you, Dr. Arwen Podesta and Dr. Joe Mather. We're so excited to have you in November at our live conference, which is happening on the 2nd, 3rd, 4th of November online. And you can register by clicking the link below or by looking at the QR code and clicking that. And we will be able to listen to all the details of the biochemical imbalances and the lab test and the things that we can do to really do the detective work to get to the root cause of what's ailing you in terms of your mental health. And I think that's the key, really, it's the difference. We're not just treating the symptoms, we're trying to uncover the root cause of why people are suffering. And it's a combination of biochemical factors, lifestyle factors, and psychological factors. And I think only really by looking at those 3 areas can we really heal people's mental health sustainably, but we can. And I think that's important, that we all take responsibility to learn as much as we can in order to become better healers. So thank you all so, so much. We're incredibly grateful and can't wait to see you there.
Thank you. I'm excited.
Thank you.
Looking forward.
Bye.
I'm